All right, let's get started. Thanks everybody for joining. Welcome. Today we're going to be discussing how Brookdale Hospital Medical Center built a nurse externship program to solve their staffing shortages. We'll also be covering some topics on nurse hiring and nurse retention as well. Just as a reminder to everybody who's joined, this webinar is being recorded, and so a member of the Incredible Health team will be in touch afterwards with a link to the recording. And this is also designed to be interactive, so please feel free to share your questions, send your questions in chat. We will answer questions throughout, and then we'll also leave time at the end to address even more of your questions. So thank you so much for joining. All right, so my name is Iman Abu Zaid. I am an MD by background. I've been in healthcare technology for the last 10 years of my career. I'm the CEO and co-founder of Incredible Health, which is the fastest growing career marketplace for healthcare workers in the US today. Incredible Health is the only platform that allows hospitals to apply to nurses instead of the other way around. And hospitals and health systems use our technology to hire nurses in permanent roles in 20 days or less, instead of it taking 80, 90 days or longer. Joining us today is Julie Mirkin. Julie is the SVP and CNO at Brookdale Hospital Medical Center. Brookdale Hospital Medical Center is one of Brooklyn's largest voluntary nonprofit teaching hospitals. It's a regional tertiary care center and a level 2 trauma center. It is part of the One Brooklyn Health System. Prior to that, Julie was a CNO at Stony Brook Medicine, and she's also served as the VP of Care Coordination at New York Presbyterian as well. Welcome, Julie. Thank you so much for joining us.
Thank you. I'm very happy to be here.
So we'll also have Dr. Delta Williams joining us for a bit as well. She is a staff nurse in the emergency department. She's an innovator, and she was the developer and the visionary behind Brookdale's nurse extern program as well. All right.
Here.
Thank you so much for joining us, Delta.
Thank you.
All right, so today we're going to be covering, we'll cover the state of the nurse labor market, just so everybody, has the lay of the land of what's happening these days. We'll also cover nurse hiring strategies. We'll learn more about the nurse extern programs, retention strategies, and then how Incredible Health can help. And then we'll definitely be leaving some time at the end for Q&A. All right, let's start with a very quick market overview of what's happening today. So healthcare is the biggest labor sector in the country by number of workers. It has been the #1 employment sector in the country since 2018. Our demand for healthcare as a country continues to increase as our population ages, but we as a country have not done a great job increasing the number of healthcare workers to meet that demand. And so there are very significant shortages of labor happening, and especially in nursing. The problem is actually getting worse, unfortunately. So we are on track to be 1.1 million nurses short by the end of this year. The annual acute care nurse turnover nationally is at 21%. It has actually increased by 2% in the last couple of years. Labor as a percentage of revenue continues to increase. It's at 48%. That means labor costs are rising. So it's not just temporary labor costs, but even the cost of our permanent labor continues to increase. And then it is taking on average 89 days to fill a permanent specialized nurse position at a hospital today, which is a very long time. The other thing I wanted to just share a bit of data with everybody is, when nurses are signing up on the Incredible Health platform, we are asking them automatically, why is it that you're leaving your job? By far, the most common reason that's selected is they're looking to advance their careers. That could mean a variety of things. It could mean I want to cross-train, I want to specialize further, I want to move into management, for whatever, expand my skills, something to do with career advancement. The second most common reason that they're leaving their current jobs is they're looking for a more flexible schedule. They want weekend options, different types of shift options, more interest in things like float pools that have more flexibility, in more part-time roles. It could be a variety of things, but something to do with looking for a more flexible schedule. The third most common is something to do with geography. They're either trying to relocate or they're trying to reduce their commute times. And then finally is compensation, looking for higher compensation. And we know that many nursing leaders very much focus in on the compensation piece, but these other areas that are driving turnover are also equally important. And we find that hospitals and health systems that focus on these areas as well tend to have stronger retention and are able to hire more as well. All right, so Julie, I wanted to turn to you and ask just for actually just a little bit of a double click. I did an overall very high level overview of the challenges that we're all facing, but could you please describe a bit more about what's happening in the nurse labor market in New York City?
Yeah, so it's a very challenging market, and I know that's a national issue. It's coupled by a variety of different concerns. One is the supply and demand of nurses is a basic economic faction. And so as we need more nurses, the need to pay them more, compensate them more, and give them more of what they're looking for in the 5 reasons that they choose to leave becomes paramount to a nursing leader. Nurses now have multiple opportunities. With the advent of COVID, telehealth and telemedicine has become much more generalized. So nurses do not need to work in a hospital any longer. And if they want that work-life balance, they have the opportunity to be flexible and work in other different areas. The supply and demand is huge, and hospitals are competing with each other. And there is a culture of the nurses today where they don't have that loyalty that they had many, many years ago of wearing a badge of honor, working in an organization for 20 years. Now it's really wherever the best offer is, wherever their best working environment is, they're jumping. And so that loyalty to the organization has to really be built so that the leaders ingrain that in the culture of the organization. Compensation is really challenging. The bar is raising up, as you know, and every hospital looks at the other hospitals when there are different salary changes and negotiations. The travel nurses have put a whole different dynamic into salary because the staff nurses are thinking, I could do the same job and somebody's working next to me making more money. Why aren't I working for a travel agency? So again, they have these other opportunities with higher compensation. And the travelers is a conundrum because the travelers we use the travelers we use, we have about 250 travelers here at Brookdale. They are absolutely a critical part of our staffing model. However, they are not Brookdale nurses. And so we work very hard to get them to be at the same culture and the same level of competency that we have of our own Brookdale staff, and they have a different view because they're transient. What we have accomplished here, which I'm very proud of, is many of our travelers really love to work here, and they've been here for years. And they like the flexibility of being a traveler, but they really only want to work at Brookdale. And so that's, I think, a tribute to the leadership. And the last big challenge is nurse resilience, which I know we'll talk a little bit more about, but nurses have tremendous moral injury. First we had COVID 3 years ago, and what the impact of the emotional well-being of the nurse during COVID is just immeasurable. And so I can talk about some initiatives that we had here to really talk about how we supported the nurses emotionally. But now that COVID is sort of on the decline, we have workplace violence. I work in Brooklyn, New York, and East New York. They actually have a TV show called East New York, and that's my neighborhood. And it's a police show, so you can only imagine they all come here. And so there's a tremendous amount of workplace violence going on, I know, across the country, but particularly in our organization where families, patients, the communities don't have those barriers to respectful, encounters. And so the nurses are experiencing not only moral injury from the COVID, but now they're moving on to workplace violence and staffing.
Got it. I think we have absolutely one of the challenges we have is it's a challenge, it's an opportunity, is that we have 5 generations of nurses working right now, and everything from Gen Z all the way to the baby boomers. Yes. And you're right in that the loyalty and badge of honor is less with the millennials and Gen Z. And by the way, that's not just nursing, that's across all industries. So that does present another set of challenges. Okay, thank you so much for sharing, Julie. We were curious to hear a little bit more about your nurse hiring strategy to tackle some of these problems.
Yeah, so there's a couple of things that we really try to focus on. One is we want to create Brookdale as my organization as a destination where any nurse that lives in this area in Brooklyn, Queens, New York, Long Island will want to come to Brookdale. And to do that, we are working on improving the image of Brookdale and all of the wonderful things that we're doing here to make nurses feel appreciated, empowered, and supported. And so we are working on social media campaigns to really get the message out that this is a place that you want to work. We are on a very, very early journey to start thinking about pathways to excellence and then ultimately magnet. But those are just terms. Really, what you want is that culture that really makes nurses feel like, I want to come to work here because this is where I feel appreciated and supported. Partnering with nursing schools is critical. And so we've done a very good job of partnering with nursing schools. Dr. Williams has met through her extern program with several nursing professors and deans. I meet with nursing school deans on a regular basis to develop those relationships. And we were really early in bringing back the nursing students to the bedside for their clinical rotations, because when they experience what it's like to be a nurse at Brookdale as a student, hopefully they would want to come here when they graduate. So that was a big initiative. Also, we have job fairs. We have a lot of job fairs, very focused on Brookdale, and we have our staff and our managers and our educators all participate to really work with the teams that are coming in to entice them to come to Brookdale. And then the nurse externship program is something that I know we'll talk about more in detail, but this is a vision of Dr. Delta Williams, and what she envisioned is that we could take third and fourth year nursing students, and we did this back in June, who are maybe off for their summer, looking for jobs and wanting to get a good education and a good experience in a hospital working as a nurse extern, which is basically a higher level patient care technician. And they're aligned with a nursing mentor on a one-to-one. And there were 22 in our program when we started. And so that's 22 new graduates that are graduating now that we can absorb into our table of organization because they've had this experience. So I think the more that you can develop relationships with nursing schools as a funnel. The other thing we've been doing is really working with other nursing schools to look at on-site programs for our non-nurses that work in areas like dietary or PCTs that aspire to become a nurse. And through various programs, we're promoting that education so we can kind of grow our own.
Okay, fantastic. There's a variety of leaders on the call from across the country, hospital leaders. Would you mind just sharing a bit more about how many nurses are you hiring every year, and your vacancy rate?
Yeah, so Brookdale has a table of organization of about 910 RNs on staff.
Okay.
Right now, my vacancy rate is about 15%, which I know is lower than industry, which I'm proud of.
Yeah.
But it's a moving target. And so one of the reasons that our vacancy rate went up a little bit is we engaged on a clinical staffing committee, which was a New York State requirement, to engage staff in determining staffing levels and staffing matrices for each of their units. And then we did a gap analysis between what the required staffing is as per the involvement of the staff nurses themselves and what the actual staffing is and where the gap was. And through the support of the One Brooklyn Health leadership, we were able to add 97.7 nursing positions, RNs, PCTs, clerical and monitoring techs. So some of my vacancy is part of those new positions that were recently added, but we do hire about 100 nurses a year. Okay.
And then how many of them are new graduates, experienced nurses? How many are coming from the extern program?
I would say probably about 30 to 40% are new grads. And the experienced nurses go into a variety of different areas. One of our biggest challenges, like many hospitals, is the emergency department, because in New York State, you really can't hire a new grad into the ER without a formalized residency program. So we are creating an ED residency program so that we can assimilate new grads into the ED. But some of the nurse externs worked in the ED, and so they got that on-site hands-on experience.
Okay. All right, so you've mentioned it a couple of times now, so we'd love to go into the topic of the nurse extern program. Can you please give us an overview of the nurse extern program?
Sure, and I'll have Dr. fill in as needed, but so the nurse extern program was really collaborating with the schools of nursing, and we focused on two major schools here, Medgar Evers and LIU, where they had nursing students that wanted to work for us through the summer, and they're still working with us. They got paid, and we paid them a salary slightly above what we would pay a PCT or a CNA. And the program, what we interviewed the prospective candidates, Dr. Delta Williams interviewed the candidates, and we actually created a per diem sort of coordinator position from one of my directors who had recently retired and was very much into education. So she came to support the program. And so these nurse externs were aligned with a nurse mentor. And so it was a one-on-one. So the nurses were trained in what to do with the externs and how to manage them and work with them. And then the externs worked one-on-one with them. And then every Thursday, we pulled them out of their clinical areas and we gave them lectures and didactics so that they would get increased nursing knowledge. One of the things that we're finding with new graduate nurses is because of the virtual education that they've been experiencing over the last 3 years, when they're coming into the hospital as a new grad, they are not possessing the basic nursing skills needed to take care of patients. So what we identified pretty early on is that the externs need nursing 101. You know, they need to really understand what it feels like to take care of a patient, do vital signs, you know, simple tasks that they really didn't get that experience in nursing school because they were virtual. So these externs are getting this real live experience daily on the units. And then Dr. Williams and our coordinator is pulling them out every week and giving them training. The other thing that we're working on now is giving them an NCLEX review class, because now that they're graduating, we anticipate hiring them as GNs, getting a permit for them to work as GNs, and then providing them with as much resources as we can to get them prepared to pass the boards. So they're getting the clinical experience on site, the didactic once a week from our team, and then we're going to be providing an NCLEX review class. The one thing that we're working on now is a contract.
Okay.
Because we're putting a lot of time and money and investment into these, you know, potential nurses. So we are looking to have them sign, and HR is finalizing that, a 2-year contract where they would say, thank you for this opportunity to be an extern. Thank you for hiring me as a new graduate. I will have 6 months to take the boards. However, in return for everything that we have given them, in turn, they will promise and commit to 2 years. And one of the things that Dr. Williams has suggested is to also give them tuition reimbursement, either loan forgiveness or future, if they're an associate, get them to the bachelor's, if they're bachelor's, get them to the master's, and give them some sort of tuition reimbursement. So that in essence is what our program entails. Is there anything else, Dr. Williams, you'd like to add?
You have done quite well.
I did well. Okay.
Okay, that's awesome. All right, we're going to go into some more detailed questions now. So how many externs are you hiring or taking per year? So.
Well, we're hoping 22, but what's happened is, 22 are here, but what's happening is other nursing schools have heard about this, and we have a lot of people that want to start with us in early 2023.
Okay, so your program's oversubscribed.
We are starting to get oversubscribed, which is always a good thing, but then you have to pause. You have to say, okay, let's get some of the foundational things finished, like the contracts, because we don't want the externs to come and be with us, get all of this knowledge and experience, and then take a job somewhere else. So right from the beginning with the next wave, and I think we said we can probably accommodate up to 40. So with the next wave of nursing students, we want to be able to have them sign some kind of agreement so that there'll be a commitment on both sides to stay at Brookdale.
Got it. And then how is your team evaluating an extern to decide whether you give them a full-time job or not?
So that's multiple ways. So the nurse that's mentoring them gives feedback as a preceptor. and lets us know. Also, Dr. Williams and the other coordinator are very involved with each specific nurse.
Program evaluation.
Yeah, so we have a program evaluation form and a formal evaluation of the applicant. And that's not to say that every extern is wonderful and we want to hire everyone, but it does give us, if there's 22 that started the program and we can hire 10 or 12 or 15 of them, that's a win to me. And so we want to make sure that the fit is good. We want to make sure that their competencies are good, and that early in their stage of being a nurse, that they're demonstrating passion, compassion, empathy, and competency. So we are looking at them, evaluating them, and the people that meet our criteria, we are making the offers.
Got it. So, under Dr. Williams' leadership, there's your current staff nurses are involved in the extern program as well. Can you just give us a sense of what's that ratio of, your existing, staff nurses to extern? How many nurses of your nurses are involved in the training and sort of program development of the externs?
It's a one-to-one.
Okay.
So we identified nurses that are willing to take on mentors and preceptors for the extern program.
Yep.
And so they follow the nurse's schedule. So
wow. Okay.
really their extension. So as many externs as we have, that's how many nurses are involved in the program. It's a one-on-one.
So it's almost like they're shadowing.
They are, and that gives them, so they're not able to perform tasks beyond their scope, but they can observe and they can assist. And so it's giving them exposure to things that they probably would not have received on a clinical rotation in nursing school. So we really want to prepare the nurses of the future. And the way to do it is to get them as senior nursing students while they have some of the, basic foundational academic knowledge, and then give them the practical skills.
Got it. And then would you be able to share what's the conversion rate? So, you have these externs, how many actually end up being your staff nurses?
So our first group of externs started in June. So they are graduating now.
Got it.
So actually, Dr. Williams and I had a meeting yesterday to talk about who are we going to hire, who we're not going to hire, who looks good. I think that we're going to net probably between 13 to 15 of them or so for the first go round.
Okay. So that's half, right? Or just over half. Okay. Awesome. And then staff nurses are very, very busy. we all know that. They have a lot going on at work. How do you encourage them to support the program? So,
it's really all about what's in it for them as well. So part of it is hopefully the altruistic professional. I want to grow, the new generation of nurses, and I'm a professional and I want to teach and mentor because that's part of what nursing does. But a lot of it is, this is another person that can help you. This is like your own PCT for the day that will help you take care of patients. And will assist you with what you need to get done for the patients. And because they're nursing students, they do have that foundational knowledge of different aspects of patient care. So they're able to really make a contribution on the units. It takes a lot of relationship building, and Dr. Williams has done an amazing job in getting nurses to sign up to be the mentors. And then we also meet with the mentors to say, how are things going? What do you need from us? What's good? What's not working? To always get feedback so we can grow the program.
Got it. And then is there any financial incentive for a staff nurse to participate in the program?
We just talked about that yesterday. Right now, there is not, but we do offer preceptor pay to our staff when they have new nurses. And some of the discussions we're going to have with HR is that they are in essence preceptoring, and that they should be able to be compensated for that.
Got it. One question that came in already from the audience, this came from Tina Ronsig. Can you share a bit more about how your preceptors are trained to work with these students?
So we have a formal preceptor class that we teach our nurses how to preceptor, and there are goals and objectives on the preceptor class. Many of the nurses that were selected, because it was a pilot and a new program, they were really handpicked by Dr. Williams and Ms. Degano, who is the coordinator of the program that we hired per diem. So they knew the competencies and the skill sets of the nurses, and they knew that the nurses would be, a very good role model to the externs. So they were handpicked. They are interested in helping, and they do see this as, nurses want more staff here, and they see this as a means to an end. Yep. So if we can bring externs on and they can treat them well, teach them great things, make them have a wonderful experience, then hopefully they'll get hired. And what we're seeing is that the externs will be hired in many of the units that they're currently working, because they've developed those relationships and they become part of the staff.
Okay, and then how do you think about ensuring the extern program is a success? Another way of asking that is like, what tips do you have for the audience for making sure their extern programs are going to be as successful as yours?
I think every program starts with a very strong foundation. So really getting the ducks in a row as to how many people you can tolerate, you can manage as an extern program, because it does take a lot of work. We've done a lot of work in teaching the externs. There are lectures every single Thursday. We've given them a lot of exposure to things they've never seen. So if there's something interesting going on in the hospital, we'll send them to observe different things. So I would say get the foundation straight. So having the number that you can manage, getting preceptors that are engaged and willing to do this. There's a lot of paperwork involved. So what we learned is that Dr. Williams has done a lot of the paperwork. She really needs an administrative support, just in filing different papers and reviews and organizing the classes. So I would get the support to have that key administrative support, even something as simple as a training room. I don't know how my colleagues on the phone are, but in our hospital, space is really difficult. Yep. And to say I need a room for a whole day for a class for externs is challenging. So we were able to find, the logistical area for her to be able to take the team out and train them. So the logistical component of it is important, and vetting the students, because I think it's important to interview them, develop the relationships with the schools, speak to the deans and the professors at the schools to see what kind of students they are in class, because if they're not a strong student in class, you may not want them to be part of your first preceptor program, for an extern. So there's a lot of logistical things. And then, as I mentioned, the contract, having some kind of mutual agreement that if we give them all of this, and not only giving them the experience, but we paid them well. A lot of student nurses don't get the opportunity to get a job in a hospital, getting paid a pretty good salary for the summer, and then be very flexible as they're back in school with part-time. We're very flexible with their schedules. So, we want to get something back from them. So we want to have some kind of contractual, mutual agreement with them. And so that's something that we're putting into place for the next group.
Okay, great. So, having a dedicated program manager, yes, it is a commitment. We do need to think about the pay for the externs, also having a contract in place with them, and then it looks like for the didactic education, you're covering a whole range of topics, right? Like wound care, COVID.
Yes, we cover tons of topics for them, and we're weaving in now the NCLEX review, because we're also finding that many new graduates are not passing the NCLEX exams, or they're struggling with it. So we want to give them some very front-loaded, NCLEX review topics. How do you take the test? Different things to make them successful. Our goal is to take these nurse externs who are nursing students and grow them into professional registered nurses, so that by the time they actually graduate, they've got a very strong foundation to transition into an RN role.
Got it. So let's go back to the beginning. How did the program get started with the nursing schools in the first place?
So that would be Dr. Delta Williams. So she said, she came to me, and actually I should mention she received our Nurse Innovator Award last year and our Nurse of Distinction.
Congratulations.
She came to me and said, and she's, as you can see, she's off picture. She doesn't like to be front and center, but she's really exceptional. So basically, she said to me, I have an idea. I want to start a nurse extern program. I want to do it quick before anyone else grabs these students. She had relationships with 2 of the nursing programs. I also have relationships with some of the other nursing schools. I'm actually a clinical professor at one of the other nursing schools. So we started building the buzz. And 2 of the schools, which are local to us in Brooklyn, LIU and Medgar Evers, jumped on the opportunity to do that. So there was a tremendous promotion, and we actually had an open house for nurse externs. And it was standing room only. We had a small classroom, anticipating a few people would show up, and I don't know, we probably had 30 or 40 people that came to our initial open house. So we're planning another one for January to get the next group in. And at that, we set expectations. I met with them and I talked about the vision of my vision for nursing at Brookdale and One Brooklyn Health. And Dr. Williams talked about what the elements of the program involved, because we wanted them to commit. We wanted them to understand that this wasn't just a job, that they were actually going to learn, and that they were going to be a partner to an RN. And really the response was overwhelming, to be honest with you. There was so much interest in it that we actually created a waiting list, because we couldn't take more than 25 at that point, because we didn't have the structure to support it. But now that the program is out, and success breeds success, so the students that are in it now are talking to their colleagues back at their schools.
Yep.
Other schools have reached out to me saying, how can we get our students into this program? And so right now we're working on the next wave and planning that.
Okay, so let's talk about a little bit more about the financial aspects of setting up a program like this. How did you support this program?
So the first thing was deciding how we're going to pay the externs. And so I have vacancies in PCTs and RNs, tremendous support. And I will say, probably I should have said this before, the very, very first step to the success of this program is getting buy-in from your HR leaders and your senior executives. So my CEO thought this was a phenomenal idea. Our HR senior VP thought it was incredible and we should do it. The cost of recruiting, the cost of turnover, the cost of open positions far outweighs the cost of paying these nurse externs. So we agreed that we would pay them a little bit more than we pay our PCTs.
Yep.
And so they got this very nice salary, and they became part of the One Brooklyn Health System. As far as going forward, we're going to continue to pay them, and you can offset the cost with the vacancies, because there's enough vacancies that, in PCTs and RNs that it offset. But to be honest with you, I was spending money on agency PCTs. And so I've been able to drop out pretty much the agency PCTs because the externs are here. And so that was almost budget neutral. And so it's really, from that perspective, it's really important. But then the foundational. So now that the program is successful and I showed proof of concept that it works, I do have a commitment from our CEO and HR that we will actually create a formal program leader, an educator type person that will coordinate and do a lot of that kind of coordination that Dr. Williams did, and then be responsible for the didactic education and the management of the preceptors. So we're actually putting in FTEs to support this program because it's been so successful, and we anticipate continued success.
Okay, so on that point, a question came in from Dr. Halley. Like, what was the program's measure of success that helped, really build this sort of return on investment or ROI case for the rest of the executives?
Well, I think, well, first of all, it did decrease my agency PCTs. So I did not need to spend more money on travel and PCTs because the externs did fulfill some of those needs. So that was a definite positive and very measurable. The other thing is just the difficulty in recruiting nurses is so, tenuous that just showing that from the extern program, if we can net X amount of nurses, that's that much less that we're spending in travel, overtime, or not good staffing in those various areas. So we are calculating the return on investment as we are formally offering and hiring all of these externs that have now just recently graduated. Some of them prefer to sit for the boards before they start. Some of them are ready to start and will take the boards and they'll be hired as a graduate nurse. But the return on investment is definitely there.
Got it. And then was there any kind of surveys or anything like that done to evaluate the program too?
We're in the process of doing that now
Okay.
because we've just finished our first semester, if you will, of having the externs. So I'd like to get feedback from them. What did they think about the program? How did they feel about it? What's good? What could be improved? And same with preceptors, the RN mentors. Because it's important to learn from, the program. It was new. And so we hope to continue to change it based on the feedback that we get.
Got it. So, I mean, just this question came in from Ronald Anderson. You mentioned your RN FTE vacancy is around 15%. And so how impactful do you feel the externship initiative has been to address that vacancy rate?
I mean, any additional FTEs that we can bring in for nursing impacts the vacancy rate. And, it's also not only about bringing in and recruiting, but it's also retaining, so it's great to bring in nurses, but then retaining nurses has also been a very significant challenge to, I think, most of us in healthcare these days because of all the opportunities and the jumping and all of that. But if I have 100 vacancies and I bring in 15 nurses, that's 15%, of my vacancy rate has just gone down. So anything that I can do to promote, if there were no nurse externs hired and the program didn't work, I would say that it's not that, it's not good, but that's not the experience that we're having. We're having an experience where I think 100% of the externs here would like to be hired. It's whether we want to hire them based on the performance that we've seen.
Got it. Okay. So you brought up the topic of nurse retention. It's top of mind for all leaders and executives at hospitals. Would you be able to share just like some of your top retention strategies for nursing?
Sure, absolutely. Well, I would say the very first top retention strategy is leadership visibility. And I've told my leaders and my managers very often that even in spite of everything I've already said about nurses jumping for money or jumping for other opportunities, I truly believe that many of the staff leave their managers. They don't leave their job, they leave their managers. So really doing some nursing training. We've started a nursing leadership academy here to train my nurse leaders. One of the things that I hear from the staff all the time is they want to know that the nurse leaders are visible and they care about them. And so when there are crises and there are issues, the nurse leaders need to step up. And so that's something that's been a major focus. We do have nurse leadership rounding and I round as well. We have senior leader rounding, nurse leader rounding. The more visible leaders can be to the staff to solve their problems on the spot, I think the more nurses will feel, supported and empowered. The other thing is that we are really looking at recognition programs. So we are very active in the DAISY Award program and the Sunflower Award because people want to be recognized. We participate in an $11.99 Union Nurse of Distinction Award, but we have our own Nurse of Distinction during Nurse Week where we nominate different nurses and teams for recognition. And we are embarking on different recognition programs. One of them that I think is really important is the sort of catch you doing something great. So it's on the spot, seeing somebody do something great and giving them a reward. And what we've been doing is giving them a lunch ticket. And it's not about the lunch ticket. It's about someone saying, thank you. I see you're doing a great job. So we're doing a lot of work with that. We've started exit interviews. So I have directors of nursing interviewing nurses that leave from different services. So they're not interviewing their own. And we're trying to find out what the nurses are saying as to why they're leaving. And to your point earlier, we have, very new nurses and I have very senior nurses here. So I've had a lot of retirement. And so you want to save that knowledge from the people that are retiring. and really impart it to the other nurses. So we're working on a lot of different things. We've added a tremendous amount of capital based on a New York State grant that we obtained at One Brooklyn Health. So things that nurses are saying I need help with as I make rounds and senior leadership rounds. We need more wows, we need new beds, we need this, we need that. And so we've been prioritizing the needs of what they're identifying so that they're hearing that what they tell us we're acting upon. And so that's been good. I think the whole thing is creating a culture where people feel valued, cared about, and supported. And as long as we can do that, I think those are the key foundational components of retaining nurses.
Got it. Okay. So we're just going to spend, 3 or 4 minutes doing a very quick overview of Incredible Health. And then we will come, and then what we're going to do after that is walk through a little bit more detail around our retention strategies. You just would love to hear more about like your training programs, for example, and how you think about scheduling and flexible scheduling. And then we'll answer more audience Q&A too. So I'm just going to pull up the slides very briefly. So Incredible Health is a software company, and our hospitals use our custom matching technology to hire high quality permanent nurses in 20 days or less. It normally takes over 80 days to fill a permanent nurse position, particularly those that are specialized. And we're already used by over 600 hospitals and health systems across the country. We're used by very large health systems like HCA Healthcare and Tenet and Kaiser Permanente. We're also used by many academic medical centers like Johns Hopkins and Stanford and Cedars-Sinai and NYU, and lots of community hospitals too. So there's 3 unique things about what we do. First, the employers apply to the talent instead of the other way around. As you can imagine, the nurses absolutely love that because they create a profile, they sit back and relax. They get different interview requests that from different employers that match to them. And the nurse gets to decide which interviews to accept and which ones to decline. Now, what's powering that also is our screening algorithm. So we are screening the nurses ahead of time, and at scale using technology and data. And then we also have matching algorithms that make sure we're putting the right nurse in front of the right employer and vice versa, depending on their preferences and their experiences and other criteria. A two-sided marketplace like ours creates an enormous amount of data. So we provide very robust data analytics to the employers we work with, and the hospitals and health systems we work with want to know how they're doing, but also want to know how they're doing relative to the rest of their market. And so because we're often working with our competitors, we can share that data in an anonymized way. So nursing leaders, HR leaders can identify what's going well and what's not going as well in the hiring process. Okay, so nurses, there are 12,000 nurses that join Incredible Health every single week. We have 1 in 4 nurses in the US use Incredible Health in some way or form. And so we offer a whole range of free tools and services to nurses, and Incredible Health is always free to nurses. Every single service and every single tool is free continuing education for every single nurse in the country available in our apps. We have free salary estimators. They get assigned a career coach or a talent advocate that helps them make some hiring decisions or some employment decisions. There's an exclusive social network for nurses built into our apps where they can get advice from each other. And lots of other content as well that helps them. And so they use the Incredible Health on their iOS app or their Android app in order to access these services that are free. Just want to share with the group just a little more data from our platform. 68% of nurses on our platform accept the very first offer they receive, and 61% of nurses accept the very first offer, even when the second or third offer has higher compensation. What this shows, and by the way, we see this in every market we operate in, whether it's New York City or Miami or Dallas or LA, or it's very consistent. What we are finding is that a hospital's operational excellence with hiring is one of the most important attributes to successfully hiring nurses. Yes, of course, brand matters, compensation matters. However, we are finding that the hospitals that are able to hire the fastest and get them through the process the fastest are able to hire more. This is just a quick case study from, this is a team in LA, and they, for this team with just traditional hiring, they were able to hire in 66 days. And then with Incredible Health, they were able to do it in 19 days. Where we had the biggest impact is actually on time to source. So, because that's usually what really drags out the days to fill. And it also results in cost savings, because as Julie said, it's very important to find programs, software, whatever it is that really brings down vacancy rates, that brings down travel nurse costs, and brings down overtime costs in order for the hospital to be able to deliver care, and for the nurse employee experience to become better too. Nurses hired through our platform have on average a 15% higher retention than the hospital's baseline. The reason for that is because they were able to consider multiple opportunities before selecting the one that they ultimately go with. So it's a very well thought out and thorough job search that the nurse is going through, as opposed to just taking the anything they can get or the first thing they can get. This is a true partnership between Incredible Health and the in-house HR team at the hospitals we work with, and the nursing teams we work with too. So, for example, this is just a slide from the work we do with Stanford. These are the 8 steps in the hiring process. Incredible Health is doing the first 4 steps, sourcing the talent, making sure they're pre-qualified, making sure they're actively looking, and automatically scheduling that very first phone screen with the Stanford recruiter, the in-house recruiter. And at that point, the Stanford team is taking over. They are completing that phone screen, getting hiring manager interviews scheduled, getting offers sent and offers accepted. So essentially, these nurses sourced through Incredible Health are entering the normal hiring process. And so this is a true partnership. It's a new model in talent acquisition too, because just like we always talk about nurses operating at the top of their skill set, we have to make sure that recruiters are operating at the top of their skill set too. And their top of their skill set is to engage and speak with talent. It's not necessarily the administrative work of sourcing and of sourcing and screening, which can be handled with technology these days. All right, so let's go into the Q&A section. For anyone who's interested in hearing a bit more about Incredible Health, please feel free to sign up for a demo. Our team is sending links in the chat now if you're interested in getting in touch. And you can also check out incrediblehealth.com. So Julie, I wanted to go back to the topic of nurse retention. And I want to hear a little bit more about your thoughts with flexible scheduling. After career advancement, it is the second most common reason why nurses are considering leaving their jobs. Traditionally, historically, it's been, many hospitals had 3 days a week, 12-hour shifts, and that's it. And that's your full-time role and no flexibility. But just curious how you're thinking about this topic strategically now.
I think you have to be innovative, and you have to be flexible, and you have to be open to new ideas and concepts. So, the typical is the 12-hour shift, but you may have working mothers or working parents that can work from 10 to 2 because they want to get their kids off to school and then be there when they get off the bus. And so thinking about different shifts at different times is something that we really need to start thinking about in healthcare. Same thing with leaders. Leadership recruitment is also very difficult. So I've had open positions, for example, a night emergency nurse manager is a hard position to fill. And we've had applicants that have said to us, can we work 12 hours? Can we work 10 hours? Can we, and you have to start thinking about it. People are not going to work 5 days a week on nights in an ER anymore. But it does have a ripple effect to all of your leaders. So I think we have to come up with, much more creative ways of thinking about it. Hospitals are also notorious for not being remote. That's like a bad word in a hospital. But I've had some of my leaders say, why can't I do like 1 day a week, 1 day a month remote, so I can catch up on all the work that I have to do? And at first people's backs are up and say, oh no, you're a nurse manager, how could you possibly work remote? But you have to start thinking about the work-life balance and the retention of your leaders to ensure that, and also the staff, how can we accomplish the same work and do it differently? And I think people just have to be open to creative and innovative scheduling and not what we're used to, because it's a different market.
Yeah, absolutely. It's any tips for getting the nursing leaders on board? Because look, the truth is, it is very operationally complex to add more scheduling options for nurses. So how do you get the leaders engaged and bought in.
Well, I think the leaders, they want to fill the positions. And I
Yeah.
think even though it gets a little more complicated in scheduling, having somebody here versus not is not the better option. So
Yeah.
I don't think the leaders are, adverse to that. I think what I'm seeing in leadership, and I teach in a master's program and a nursing program, and I hear from the leaders that are students of mine, that they look and see what's happening and what the staff are receiving as some of these options, and the leaders are not getting the same options. So
Got it. Okay.
there's also piece of how do you keep the leaders engaged so that when they want certain flexibilities, you're able to accommodate that. So we do work on that here. One of the things that One Brooklyn Health has here, which I've never seen, is my nursing leaders are able to do what we call moonlighting, which is basically if they want to sign up and cover a shift or cover the house in addition to their normal work, they will get paid for it. And I've never seen that anywhere I've worked before, where leaders actually get compensated. And so I try to keep them engaged as well through various programs and different things that are creative.
Okay. And then let's talk a bit more about the number one, what we see is the most common reason why nurses are looking for new jobs, and that's career advancement. You already went through the amazing example of the extern program, but beyond that, sort of what other career advancement initiatives do you have at your hospital to help address that?
So we really promote education and career advancement. So we have many, many nurses that are working at the bedside. Dr. Williams is a perfect example, who is a staff nurse with her doctorate. Some nurses want to advance academically, but love patient care, and they don't aspire to be, a leader or an educator. They just want to stay at the bedside. So we strongly encourage career advancement through degrees, through different programs. We partner with a lot of different entities to get, like right now we have a partnership with nurse anesthetists. So if any of our critical care nurses are aspiring to be a nurse anesthetist, we have a partnership with a program where they can fast track into that. So we promote that to make sure that, it's something that we really look at.
Okay. Another question from Dr. Halley in the audience is the nurse externship program a feeder to your new graduate program?
Yes, absolutely. So they will pretty much come in as new graduates.
Okay,
Unless they decided to take the boards. Yeah, so they do. And then for the new graduate program, we've developed a pathway for them where we're really giving them a lot of training, a lot of nursing 101 again, getting them back into the classrooms. We have a partnership with our physician counterparts. We have a sim lab here. We have access to the sim lab. So we're going to start doing a nursing 101 because, again, many of them worked virtually and never had the opportunity to touch a patient. And so they're coming out of nursing school and they're not really prepared.
Got it. And then do you support, another question that came in is do you support cross-training for your nurses?
We support it. If nurses are interested in learning about other areas, we do. We do have some contractual obligations as far as, moving people from one area to another. But what we do really encourage is growth. So, and unfortunately for our med-surg units, they seem to be the foundation of all nursing coming in, and then everybody wants to leave and go to labor and delivery and ER and critical care.
They're the feeder program.
But we promote that because that's growth, and we want our nurses to stay at Brookdale, and we want that. And the good thing about our organization is we're large, and there's so many opportunities between, critical care, cath lab, ambulatory. We've got, a large chemotherapy program. I mean, there's a lot of opportunities for them to transfer into.
Got it. Another question that came in from Tina is how many, this is about the extern program again, how many hours per week do the students work to balance in the extern program versus, because they're trying to balance it with school too?
Yeah, I mean, it varies. In the summer, they were working pretty much full time. Some of them have continued a modified full-time schedule, but many of them have said they only want to work 2 days a week because they're in school and they want to be able to study. So some of them are working part-time and some of them are working more hours. But we, again, are very flexible to accommodate their schedule to keep them aligned with us so that they don't pursue other opportunities.
Got it. So another very specific question that came in from Catherine. NCLEX is changing soon. How is that going to impact your organization, or do you have any predictions of what kind of impact it's going to have?
Yeah, so we're adjusting our NCLEX review program to meet the needs of the new testing. So we're on top of that. But yes.
Okay. So I'll ask the final question now. And what would you say, so as a CNO, what would you say, and given everything that's going on in healthcare right now, what would you say is your top tips and advice for your peers that have attended this webinar?
So I think my top tip and advice is to, oh my goodness, let me think about this. So I would stay the course. You know, it says what keeps you up at night, and my answer is almost everything keeps me up at night lately. I think for recruitment, retention, and staff, there's a couple of things. One is being very innovative and open to new ideas, and very, very strategic as far as getting nurses in, you know, being competitive with your competitors. We have tremendous competition here in New York. So, you know, for my organization, the nurses can come to Brookdale or One Brooklyn Health, or they can go to one of the huge health systems that have a lot of resources. So how do I make Brookdale be the magnet destination for the nurses? And always reinventing yourself to be that magnet destination, I think, is super important. I think the second phase is, how do you keep them? How do you retain them? And one of the things that we've addressing here as well as burnout, you know, and the resilience. And when COVID struck a couple of years ago, Brookdale was the hardest hit hospital in the tri-state area, secondary to Elmhurst and Queens per capita.
Wow, okay.
So my staff had tremendous moral injury. And at the time, and we continue to use it, there was an app called Degree, which was an emotional support app. You know, give your staff whatever tools you can give them to help them to get through the tough times. And so somebody saw us on CNN and said, I feel so bad for your hospital. I want to give you this app to help your staff. And so we provided this app where the nurses could communicate with a community of nurses. And the Degree app actually gave them emotional support. And many of my staff said, gosh, you know, thank you for that. If it wasn't for that, I don't know how I would have gotten through it. And then creating Zen rooms and creating timeout spaces and, you know, just creating time for nurses to decompress, I think, is the second piece. And then lastly, I can't stress it enough, being visible as a CNO, being visible as a director and a manager, knowing your staff, knowing what their lives are about, you know, making rounds regularly and just offering support and listening. Because so often I will make rounds and somebody will tell me something so simple like, I can't get my printer to work. And I've done 10 tickets to IT and nothing's happening. And I unfortunately make the call and it's done. And it shouldn't be that way, but it is that way. And so when staff start to see you caring about them, caring about their, you know, work-life balance, you know, showing a personal interest and being supportive, I think that's really the key to creating a resilient, positive, retaining staff. And that's what I would say to the CNOs and the HR people out there. I would just say, be creative and just do it. Just figure it out. And if it doesn't work, go back to the drawing board, but get out of the box and start thinking out of the box, because it's a new world and we've got to be innovative to really meet the goals of retaining a good nursing staff.
Absolutely. What the question already, I knew the question was going to come in. What was, can you repeat the name of the app that helped during COVID?
Oh, Degree, DUGRI. And you can look it up. It's amazing. And it really helps nurses. It's not a social media platform. It's a one-on-one communication platform. And it really helped my staff. My staff, and Dr. Williams was one of them. When I said to them, I've got some person called me randomly that saw us on CNN because COVID was so devastating to this organization and said, I have an app that I can help your staff. Would you be a beta site for us? Would you like to test it out? And honestly, my staff were like, I'm not getting on that phone. Who are these people? Are they going to watch what I'm saying? But it's not a social media platform. It's actually an app that is career peer-to-peer support for professional nurses. And it's really phenomenal. And we're continuing to use it. And I have to say, I can't say enough about it. But, you know, any tool you can find to support your staff, that's what it's all about. And one of the things that my staff said to me is, don't buy us pizza. Like, stop buying us pizza. You know,
Yeah.
that's not what they want. They want to be heard. They want to feel supported. They don't want food. And so I took that to heart and tried to figure out how we can support them.
Got it. For everyone in the audience, please, if there's some questions that we weren't able to get to, or you think of a question afterwards, feel free to email us at questions@incrediblehealth.com, and we'll do our best to answer either ourselves or ask or through Julie. And if you have any, the webinar has been recorded, and so a member of our team will be in touch with the recording. Julie, I just want to thank you so much. Dr. Williams too. Thank you so much for joining us today and sharing your experiment, which is now working, and your overall strategies for nurse hiring and retention. Just really appreciate it. We're all, you know, facing these challenges, and it's great to hear from our peers like yourself.
Well, Dr. Williams and I would like to thank you for, you know, inviting us to share our experience, and I'm happy to answer questions going forward if anyone wants to reach out to me as well. But thank you so much for this opportunity. It was really a pleasure.
All right. Thank you. Thanks, everybody. Thanks, everyone, for joining.
Bye-bye.
Bye-bye.